If you're over 60 and you've noticed that erections are weaker, slower, or less reliable than they used to be, the problem is probably not what you think. Most men assume it's simply age, low testosterone, or that's just how it goes after 60. But as a physician, I can tell you something most men never hear inside a doctor's office. Erectile strength is primarily a blood vessel issue, not an age issue. Erections are a vascular event driven by nitric oxide release, smooth muscle relaxation, proper nerve signaling, balanced blood sugar, and stable testosterone levels. And anything that damages blood vessels, spikes insulin, increases inflammation, or disrupts hormone balance can quietly weaken erections over time. Now here is the uncomfortable truth. Some fruits, especially when consumed in excess or in the wrong metabolic state, can worsen the very pathways that support erectile function, particularly in men over 60 who already have reduced insulin sensitivity and declining endothelial function. This does not mean fruit is bad. It means metabolism changes with age, and certain fruits can create problems in men who already have prediabetes, insulin resistance, fatty liver, or vascular stiffness. The first fruit that may worsen erectile function in susceptible men is watermelon. Yes, the same fruit often marketed as natural Viagra. Watermelon contains citrulline, which can convert to arginine and potentially support nitric oxide production. However, here's what most people don't realize. Watermelon is also very high in natural sugars and has a high glycemic load when eaten in large portions. In younger individuals with robust insulin sensitivity, this may not be an issue. But in men over 60, especially those with insulin resistance, large servings of watermelon can spike blood sugar significantly. Elevated glucose increases oxidative stress and directly damages endothelial cells, the inner lining of blood vessels responsible for nitric oxide production. Studies in vascular medicine clearly show that post-meal blood sugar spikes reduce endothelial function for several hours. That means if your blood sugar jumps sharply, nitric oxide availability drops, and erection quality suffers. So while watermelon contains compounds that may help nitric oxide, its sugar load can override those benefits in metabolically compromised men. The second fruit that can indirectly weaken erections in certain men is ripe banana, particularly overripe bananas. Bananas are often recommended for energy and potassium, but as they ripen, their resistant starch converts into simple sugars, increasing their glycemic impact. For men over 60 with reduced insulin sensitivity, frequent high-sugar fruit intake can increase visceral fat and suppress testosterone levels over time. Research in endocrinology journals shows that chronic hyperinsulinemia lowers sex hormone-binding globulin balance and can disrupt testosterone signaling. Additionally, excess sugar intake promotes inflammation and advanced glycation end products, which stiffen blood vessels and impair circulation. Erections require flexible arteries and strong microvascular dilation. Anything that stiffens vessels weakens performance. Bananas in moderation are not dangerous, but daily high intake in sedentary, insulin-resistant men may contribute to declining vascular performance. The third fruit that deserves attention is mango, particularly in juice or smoothie form. Mango is delicious and rich in vitamins, but it is also one of the highest natural sugar fruits. When blended into smoothies, fiber is partially broken down, increasing speed of sugar absorption. For older men, rapid sugar absorption leads to sharp insulin spikes, which over time promote abdominal fat accumulation. Visceral fat is hormonally active and converts testosterone into estrogen through aromatase activity. Increased abdominal fat correlates strongly with erectile dysfunction in medical studies. The mechanism is not psychological, it is biochemical. Elevated estrogen relative to testosterone, combined with insulin resistance and endothelial dysfunction, creates the perfect storm for weaker erections. Mango juice, in particular, behaves metabolically similar to soft drinks. Liquid sugar is absorbed quickly and suppresses nitric oxide availability through oxidative pathways. Again, the fruit itself is not poison. The metabolic context determines the effect. The fourth fruit that may negatively impact erections in some older men is canned fruit packed in syrup. This is less about the fruit and more about the processing. Canned peaches, pears, and fruit cocktails stored in heavy syrup contain added sugars that dramatically increase glycemic load. Repeated glucose spikes damage small blood vessels first, exactly the vessels required for penile rigidity. Diabetic erectile dysfunction is one of the earliest complications of poor glucose control because penile arteries are small and highly sensitive to endothelial damage. Research consistently shows that microvascular dysfunction precedes large artery heart disease. That means erection problems are often an early warning sign of metabolic dysfunction. Men who consume frequent high-sugar foods, including syrup-packed fruits, may unknowingly accelerate vascular decline. Another issue often ignored is fructose metabolism in the liver. High fructose intake, especially from juices and processed fruits, can promote fatty liver in susceptible individuals. Fatty liver correlates strongly with low testosterone and systemic inflammation. Testosterone production depends on metabolic health. When liver function declines, hormone metabolism becomes impaired. That is why many men with metabolic syndrome experience both abdominal fat gain and erectile decline simultaneously. It is not coincidence, it is shared pathology. Now let me be very clear. Whole fruits in moderation, especially low glycemic fruits like berries, are generally beneficial. The problem arises when high-sugar fruits are consumed in excess, especially in men with pre-existing insulin resistance, poor sleep, low physical activity, or visceral fat accumulation. Erectile function after 60 is primarily about blood vessel integrity, nitric oxide availability, hormonal balance, and metabolic flexibility. Anything that worsens insulin resistance or vascular inflammation can indirectly impair performance. One more factor many men overlook is timing. Eating high-sugar fruit late at night can elevate nocturnal glucose levels and disrupt growth hormone cycles during sleep. Growth hormone supports tissue repair and vascular health. Poor sleep further elevates cortisol, which can reduce testosterone production over time. So when fruit intake is excessive, poorly timed, or combined with other high-sugar foods, the cumulative metabolic load becomes significant. In clinical practice, I have seen men improve erectile quality simply by stabilizing blood sugar, reducing liquid sugars, and losing visceral fat, even without medication. This is because erectile dysfunction is often a vascular warning signal, not a standalone problem. The penile arteries are about 1/3 the size of coronary arteries. If they are struggling, the heart may be next. That is why cardiologists often say erectile dysfunction can precede heart disease by several years. It is not just about performance, it is about vascular health. The takeaway is not to fear fruit, but to understand metabolic context after 60. Large portions of high-sugar fruits, fruit juices, smoothies, and syrup-packed fruits can worsen insulin spikes, promote inflammation, increase visceral fat, lower testosterone signaling, and reduce nitric oxide availability in susceptible men. Erections depend on vascular relaxation and smooth muscle response. Stable blood sugar, flexible arteries, healthy endothelium, and balanced hormones are essential. When those systems are stressed, erectile strength declines. The solution is not eliminating fruit entirely, it is choosing lower glycemic options, controlling portions, pairing fruit with protein or healthy fats to slow absorption, and focusing on overall metabolic health. Erectile performance after 60 is not purely age-related. It is strongly influenced by blood sugar stability and vascular integrity, and for many men, small nutritional changes create surprisingly powerful improvements. Now that we've talked about how certain high-sugar fruits can quietly worsen erectile performance in metabolically vulnerable men, let's shift to the empowering part, because erectile function after 60 is not just about avoiding problems. It's about actively supporting the biology that creates a firm, reliable erection. And here is something most men never hear clearly explained. Erections are not driven by testosterone alone. They are primarily driven by nitric oxide, endothelial health, arterial flexibility, nerve signaling, and blood flow efficiency. Testosterone plays a supporting role, but without healthy blood vessels, even normal testosterone cannot produce strong rigidity. That means the fastest way to improve erection quality naturally is to improve vascular function and nitric oxide production. So let's talk about 4 foods that directly support these pathways and are strongly backed by cardiovascular and metabolic research. The first food is beetroot. Beetroot is one of the richest natural sources of dietary nitrates, which convert in the body into nitric oxide. Nitric oxide is the molecule that signals blood vessels to relax and expand, allowing increased blood flow into penile tissue. In fact, the same nitric oxide pathway is what prescription erectile medications enhance. Several clinical studies have shown that dietary nitrate intake improves endothelial function, lowers blood pressure, and enhances vascular dilation. For men over 60, endothelial dysfunction is one of the most common reasons erections weaken. As we age, nitric oxide production declines due to oxidative stress and inflammation. Beetroot helps bypass some of that limitation by supplying the raw materials needed for nitric oxide generation. Research published in cardiovascular journals demonstrates that beet juice can improve blood flow within hours of consumption. Importantly, this is not a stimulant effect, it is a vascular support effect. Better circulation means stronger filling of erectile tissue. Additionally, beetroot supports mitochondrial efficiency, meaning cells produce energy more effectively, which improves overall stamina. For best results, whole beets or fresh beet juice without added sugars are preferable, and pairing them with a protein source helps stabilize blood sugar. The second powerful food is fatty fish, particularly salmon, sardines, and mackerel. These fish are rich in omega-3 fatty acids, especially EPA and DHA, which are critical for reducing inflammation and improving arterial flexibility. Chronic inflammation stiffens blood vessels and reduces nitric oxide availability. Omega-3 fats improve endothelial cell membrane fluidity, making blood vessels more responsive to dilation signals. Studies show that higher omega-3 intake correlates with better vascular health and lower incidence of erectile dysfunction. In older men, arterial stiffness increases naturally with age. Omega-3 intake has been shown to reduce arterial stiffness and improve blood flow dynamics. Another key factor is that omega-3s improve insulin sensitivity. Remember from part 1 that insulin resistance is a major contributor to erectile decline. By improving metabolic flexibility, fatty fish indirectly supports testosterone balance and reduces visceral fat accumulation. Furthermore, omega-3 fats may support nitric oxide synthase activity, the enzyme responsible for nitric oxide production. This means they work synergistically with nitrate-rich foods like beets. The third essential food is leafy greens, especially spinach and arugula. Like beetroot, these vegetables are high in natural nitrates, but they also contain magnesium, folate, and antioxidants that protect nitric oxide from oxidative breakdown. Nitric oxide is fragile. It can be destroyed quickly by free radicals. Leafy greens help preserve nitric oxide once it's produced. Magnesium in particular plays a crucial role in vascular relaxation. Many older adults are magnesium deficient due to poor absorption and medication use. Magnesium deficiency is associated with increased vascular constriction, higher blood pressure, and impaired endothelial function. Studies have linked higher magnesium intake to improve testosterone levels in some men, particularly when combined with physical activity. Leafy greens also support homocysteine regulation through folate content. Elevated homocysteine damages blood vessels and increases cardiovascular risk, which directly impacts erectile function. Think of leafy greens as vascular insurance. They protect the delicate lining of arteries that erections depend on. The fourth food that deserves strong attention is pomegranate. Pomegranate is rich in polyphenols and powerful antioxidants that directly improve endothelial health. Research has shown that pomegranate juice consumption improves blood flow, reduces oxidative stress, and may improve erectile performance in men with mild to moderate dysfunction. The mechanism is not hormonal, it is vascular protection. Pomegranate polyphenols help increase nitric oxide bioavailability by reducing oxidative destruction. Some studies suggest that regular pomegranate intake can improve arterial dilation and reduce plaque progression. For men over 60, plaque buildup and microvascular damage are common contributors to erection problems. Supporting endothelial integrity is critical. Unlike high-sugar fruit juices, pomegranate should be consumed in controlled portions. Small amounts of pure juice or whole seeds are preferable to sweetened blends. Now let's zoom out and understand why these foods work together. Erections require three major systems to function properly: vascular health, nerve signaling, and hormonal balance. These four foods primarily enhance vascular health, which is the foundation. Even if testosterone is slightly lower after 60, strong blood flow can maintain good erectile function. However, if arteries are stiff and inflamed, even high testosterone will not compensate. That is why cardiologists often view erectile dysfunction as an early cardiovascular warning sign. Improving endothelial health improves both heart and sexual performance. Another critical element is blood sugar stability. All four of these foods are low glycemic and support insulin sensitivity. Stable blood sugar reduces cortisol spikes, lowers inflammation, and protects nitric oxide pathways. In contrast, frequent glucose spikes damage small blood vessels first, the same small vessels required for rigidity. It is also important to mention protein intake. Adequate protein supports muscle mass, and muscle mass improves insulin sensitivity. Men who maintain strength after 60 tend to maintain better vascular health and testosterone signaling. Combining nitrate-rich vegetables with resistance training creates a powerful synergy for blood flow. There is also emerging research on the gut microbiome's role in nitric oxide production. Oral bacteria convert dietary nitrates into nitrites, which then convert into nitric oxide. This means excessive antibacterial mouthwash use may reduce nitric oxide production. Supporting a healthy oral microbiome may indirectly enhance the effects of beetroot and leafy greens. Few men are aware of this connection. Sleep also plays a crucial role. Testosterone production peaks during deep sleep, and chronic sleep deprivation reduces testosterone and increases cortisol. Even the best foods cannot overcome poor sleep hygiene. Erectile strength after 60 is a systems issue, not a single nutrient issue. The good news is that vascular tissue responds quickly to improvement. Studies show endothelial function can improve within weeks of dietary changes. Many men notice improved morning erections within 1 to 2 months of improving metabolic health. Morning erections are a key marker of vascular and neurological integrity. If those improve, overall performance often follows. I want to emphasize something important. There is no single magic food that guarantees instant results. The body operates on biological principles. When you improve nitric oxide production, reduce inflammation, stabilize blood sugar, support testosterone, and protect endothelial cells, erections improve naturally as a byproduct of better health. That is sustainable improvement, not temporary stimulation. So instead of chasing quick fixes, focus on daily vascular support. Beetroot or leafy greens for nitrates, fatty fish for omega-3s, pomegranate for antioxidants, adequate protein for metabolic stability, proper sleep for hormonal balance, and strength training for circulation. Erectile function after 60 is not lost. It is often suppressed by vascular dysfunction and metabolic stress. Remove those barriers, and the body frequently restores performance more than men expect. Strong erections are not just about masculinity, they are a sign of healthy arteries. Protect the arteries, and you protect performance.